everyone, welcome back to Academically. I am Sunidhi Shahi, your host, and today we are going to talk about a very important topic for international medical graduates who are aiming to practice medicine in Australia. We are comparing two assessments, the AMC Clinical Exam and the PESCI. Before we get started, don't forget to like this video, subscribe to our channel and hit the notification bell for more content on healthcare careers abroad. First, let's talk about the AMC Clinical Exam. The Australian Medical Council AMC Clinical Exam is designed to assess your clinical skills and knowledge to ensure they match the standards of a graduate from an Australian medical school. This exam is a multi-station objective structured clinical examination or OSCE. You will encounter a variety of scenarios that cover different disciplines like medicine, surgery, obstetrics, pediatrics, and psychiatry. Each station tests your ability to take patient history, perform physical examinations, make a diagnosis, and manage patient care. Communication skills are also a key component of the assessment. Now, let us move on to PESCI, which stands for Pre-Employment Structured Clinical Interview. Unlike the AMC Clinical Exam, PESCI is not a general assessment, but it is tailored to evaluate your sustainability for a specific job within a healthcare facility. The interview is structured and includes clinical case scenarios related to the specific position you are applying for. For example, if you are applying for a role in general practice, the scenarios will be relevant to that setting. PESCI also assesses your cultural understanding and communication skills, ensuring you are a good fit for the role and the environment. So, what are the key differences between the AMC Clinical Exam and the PESCI? Exam versus interview. AMC Clinical is an exam with a focus on what you do rather how you do it. For instance, you could say, "I am sorry you have cancer" in a neutral tone and it wouldn't impact the outcome much. In PESCI, the way you communicate, including showing genuine empathy, is important. Now, role variation. In AMC Clinical, your position changes in station to station. You might be a GP in a rural area and a registrar in a hospital, or a resident medical officer in an emergency department. However, if we talk about PESCI, you are consistently a GP in a specific clinic tied to a particular location and set of responsibilities. Passing criteria. In AMC Clinical, you have 16 stations and need to pass 9. You can afford to miss out on one branch, although this isn't recommended. In PESCI, failing one of the 4-5 stations usually results in failing the entire interview. Investigations. In AMC Clinical, they judge you based on what investigations you missed. In PESCI, you are marked on what you requested and, importantly, what you should not have requested. Guideline knowledge. AMC Clinical focuses on international guidelines but not in-depth specification. For PESCI, you need to know specific Australian guidelines. For instance, AMC might have a general stance on euthanasia, but in PESCI, if your clinic is in Victoria, you need to be aware of the specific conditions under which it is allowed. Attitude. In AMC Clinical, you are often adopting a student-like attitude. In PESCI, you are expected to take on a doctor's attitude, showing the professionalism expected of a practicing GP. Overall assessment. AMC Clinical judges you purely on exam performance. PESCI takes into account a wider range of factors including your social media presence, body language, the clinic environment, your supervisors, the level of risk you are taking, and your working hours. Examiners. In AMC Clinical, you interact with 16 different examiners across stations, which means you could give similar responses without much issue. In PESCI, it is often the same panel assessing you, so you need to avoid reiterating the same case or responses. So guys, in summary, while both the AMC Clinical Exam and PESCI are critical steps in your journey to practice medicine in Australia, they serve different purposes and have different requirements. I hope this video has helped you clarify the differences between the AMC Clinical Exam and PESCI. If you have any questions, any doubts, or any topic you would like us to cover, please leave them in the comments below. Thanks for watching this video. Good luck on your medical journey in Australia. This is Sunidhi Shahi signing off.